Hello, everyone. I am Ryan Morgenstern, and this is a public service announcement on Streptococcus pyogenes. Type of pathogen. The Streptococcus pyogenes, or group A strep, is a gram-positive and catalase-negative bacteria that is arranged in chains. Mode of transmission. The bacteria is spread by direct contact with discharges from the nose and throat of infected people or by contact with infected wounds or sores on the skin. Mortality and morbidity rates. Streptococcus pyogenes results in a wide variety of diseases, from severe invasive infections to mild superficial infections of the throat or skin. Non-invasive Streptococcus pyogenes has a morbidity rate of approximately 25% and a mortality rate of 0.1%. On the other hand, invasive Streptococcus pyogenes has a morbidity rate of less than 0.001% and a mortality rates that range from 10 to 30%. Origin and affected regions. Streptococcal diseases have been known for centuries and were originally discovered by Theodor Billroth in Austria during the 19th century. The pathogen is prevalent all over the world, yet its highest rates are within developing nations. Interesting facts. Anyone can get a group A strep infection, but some infections are more common in certain age groups. Strep throat and scarlet fever are most common in children between the ages of 5 and 15 years. Impetigo, a skin infection caused by Streptococcus pyogenes, is most common in children between the ages of 2 and 5. When a child has a sore throat, there's a 37% chance it has group A strep. Some signs include red and swollen tonsils, sometimes with white patches of streaks of pus, swollen lymph nodes in your neck, tiny red spots on the area at the back of the roof of the mouth, body rashes, and fever. Some symptoms include throat pain, usually comes on quickly, painful swallowing, stomach pain, headaches, nausea, and body aches. Diagnosis. After an initial physical examination, the doctor will give a rapid strep test involving swabbing the throat and running a test on a swab. If the test is positive, the doctor can prescribe treatment. If the test is negative, yet the doctor still suspects Streptococcus, then the patient can take a throat culture swab, which will be analyzed in a lab. Prognosis. With early diagnosis and treatment, the vast majority of patients recover in about 3 to 10 days. Rarely, the infection may spread to deeper levels of the skin and soft tissues. Complications may lead to severe invasive infections. Treatment and care. If a patient has Streptococcus pyogenes, they will usually be prescribed oral antibiotics. The recommended duration of antibiotic treatment is 5 days. It is recommended to drink warm liquids and gargle baking soda mixed with salt water. Throat lozenges can also be used to soothe the sore throat. Prevention. Properly wash your hands regularly with soap and water for at least 20 seconds, especially before eating. Make sure others cover their mouth when sneezing and coughing. Do not handle used tissues or other germy items. And wash dishes and cutlery in hot, soapy water. Thank you for listening to my public service announcement.